The newsday continues here on One News Now. I'm Riza Diaz. An election watchdog is urging Comelec to come up with ways to accommodate voters who will be unable to cast their ballots in the May 2022 elections. To tell us more about this, we have Camille Samonte joining us this afternoon over the phone. Good afternoon, Camille. What is the group proposing for next year's elections?
Yes, Lisa, election watchdog Kontra Daya is urging the Commission on Elections to come up with alternative mode of voting for those who will be under quarantine and for areas under general lockdown for the 2022 elections. Kontra Daya convener Professor Danilo Aro said the Comelec should be creative and inclusive in coming up with ways of voting without violating election rules. Aro suggested to explore the idea of putting up a roving precinct in quarantine facilities in areas under general lockdown. Through these, precincts can reach residents of COVID-19 patients who are unable to physically go to polling places. The expansion of early voting mechanism is another way to accommodate affected voters. Residents under general lockdown may be included in the early voting. Arrow emphasized that the public should never be deprived of their right to vote regardless of the COVID-19 situation. Comelec earlier said that isolation polling places will be set up on election day. However, this will only accommodate voters who would have COVID-19 symptoms. Riza Kontra Daya also called on Comelec to extend the voters' registration until January 2022. Professor Aro said 4 months is already enough to make up for the lost time for applicants to register due to quarantine restrictions. Riza?
Thank you, Camille Samonte, for the updates. Meanwhile, in the United Nations General Assembly, African and South American leaders are calling out a vaccine inequity. They say global herd immunity is not only the key to recovery, but also a quote moral duty. Let's listen in to this Bloomberg Quick Take.
Despite our placing the vaccine program high on the list of mitigation measures, Zambia has only managed to vaccinate a mere 3% of its population. This is against the country's target of vaccinating 70% of the eligible population by the third quarter 2022. This clearly highlights the inequitable access to vaccines developing countries, especially that more than 2 billion vaccines have been administered worldwide. Mr. President, it is fair to state that recovery from the pandemic hinges upon mass vaccinations before considering other reforms or facilities that tend to fail when countries lock down their economies.
Hubo una carrera contra el tiempo para desarrollar las vacunas. Se hizo a una velocidad récord. Y ojo que no quiero hablar hoy aquí de las patentes ni de las fórmulas. Quiero hablar del acceso a las mismas. Y ha habido un suministro deficitario en las vacunas. Deficitario y no equitativo. Los países tuvimos que salir a comprar cada uno por su lado. ¿Y por qué creo importante hacer hincapié en esto? Porque el proceso de vacunación todos sabemos que es vital para recuperar la libertad en nuestros países.
Convoco a la comunidad internacional a fortalecer el multilateralismo en materia de salud y avanzar en la equidad para la distribución de las vacunas. Señores delegados, este es nuestro deber moral. Si se mantienen atrasos en la distribución equitativa de vacunas para todas las naciones, nos exponemos como humanidad a que nuevas variantes puedan atacarnos con mayor ferocidad. La inmunidad global requiere de la solidaridad para que no exista acaparamiento de unos frente a las necesidades de otros. Son inauditas.
heart disease is still the cause of most deaths in the country, with over 56,000 Filipinos succumbing to it in the first half of the year. Camille Samonte has the details.
Despite the COVID-19 pandemic, heart diseases remains the top cause of death in the Philippines. Based on the last report of Philippine Statistics Authority, from January to June 2021, more Filipinos died because of ischemic heart diseases or illnesses causing oxygen deprivation in the heart. Cerebrovascular meanwhile plays second. This happens when blood flow to your brain stops and may lead to stroke. It is followed by cancer, diabetes, and COVID-19. Medical experts from Singapore explain that there are two reasons why many people suffer from heart diseases. It could be caused either by hereditary risk factors or an unhealthy lifestyle. Oftentimes, eating too much fatty food, salt, and sweets may lead to heart illness, as well as lack of exercise and excessive drinking and smoking. If you experience chest discomfort, shortness of breath, tiredness, dizziness, and palpitation, it is best to consult a doctor. A medical expert said most patients with heart diseases are already severe and has complications due to irregular checkups.
It is important to be careful with our lifestyle, be aware of symptoms, not to push back and assume it's harmless. These symptoms of shortness of breath and chest pain may be something like a warning sign, and usually that should be evaluated. I think identifying disease early and treating them earlier, it remains the most important tool. As you know, prevention is so much better than cure.
Another doctor, meanwhile, emphasized the importance of having a healthy lifestyle to prevent heart diseases.
We always advise lifestyle changes. Again, in terms of lifestyle, exercise, weight loss, and a low salt diet. So again, even before we consider further therapy, look at the patient in general. Is the patient overweight? Is he sleeping well enough? Is he very stressed? Again, see if there's any adjustment to lifestyle that can be achieved to lower the blood pressure.
For News 5, Camille Samonte, We Are One News.
But COVID deaths in the country are still a raging concern. In Tabuk City in Kalinga, records show increasing deaths as the virus takes its toll on the city. Speaking to us earlier, Tabuk City Public Information Officer Aurora Amilig said that the deaths induced the LGU to dig additional graves. The surge has also overwhelmed their healthcare system. We have also received a report that Tabuk is now experiencing a shortage in coffins.
We have recorded 46 deaths since Friday, but I think we have additional 3 this weekend. And like you said earlier, the city local government has ordered, the digging of additional graves in another barangay, which is because the burial site in Balong for COVID cases, according to the barangay officials, it's nearly full.
Amilig added that the city also suffers from a shortage of oxygen supply as suppliers have doubled their prices.
Hospitals are running out of oxygen, or they have actually run out of oxygen. And he wanted to purchase, these oxygen concentrators. We were discussing about the oxygen concentrators, portable ones that can be used even in our treatment facility, since the hospitals are no longer accepting symptomatic severe cases.
The coronavirus pandemic hit airports hard as countries enacted policies to limit global travel. Now, this has caused the Hong Kong airport to lose its distinction as Asia's busiest airport. This Bloomberg Quick Take tells us more.
Hong Kong lost its top spot as Asia's busiest airport in 2020 when passenger traffic slumped 88% from 2019. The lack of a domestic market and strict COVID rules have made for a slow recovery, and walking through the airport, the majority of F&B outlets and shops do remain closed. Here in the departure hall, long stretches still remain boarded up in areas where you would typically see throngs of passengers waiting to board their flights to destinations across the world. Only 2 lounges do remain open to travelers. One operated by the Plaza Premium Group and the other by Cathay Pacific, down from the 12 that are usually open here at the airport.
Unfortunately, when COVID had hit, we had closed a lot of our lounges and airport hospitality services. We're cautiously optimistic with the growth.
COVID certainly has forced a rethink of strategy to be nimble in the face of policy uncertainty during the pandemic era.
Let's now take a quick look at today's other top stories. Opposition coalition Isang Bayan is optimistic about its chances for the 2022 elections. Isang Bayan vows to unite the opposition for next year's polls. Baguio City's reproduction rate is now higher than Metro Manila's due to the presence of the highly infectious Delta variant. Baguio City's Public Information Office said that the surge is not showing any sign of letting up for now. And the Health Department is urging caution in interpreting the recent COVID-19 data. The DOH said the lower case turnout is due to several factors, including fewer tests and higher antigen testing. Recall that results of antigen tests are still not included in the agency's daily case tally. And those are the top stories of the hour. Join us later at 2:15 as we continue to monitor the day's biggest stories. You can also catch news on Signal Play app. Register for a free account now. Register for a trip at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.